Okay, how about the types of written information that can be provided to a patient? So these include things like med guides, patient package inserts or PPIs. This also includes consumer medication information or CMI leaflets, as well as the instructions for use. So let's talk about consumer medication information or CMI leaflets. The Food and Drug Administration, FDA, mandates that useful written patient information is provided to patients with each new prescription. Consumer medication information, or CMI handouts, are the paper leaflets of drug information that are put inside the prescription bag or stapled to the outside. These are not actually reviewed or approved by the FDA. The information should be simplified for patients to understand and should reflect the FDA-approved package insert. They should explain how to use the drug, receive benefits, and how to avoid harm. The patient package inserts, or PPIs, with these types of written information, in the 1970s, the FDA required that all oral contraceptives be dispensed with the FDA-approved patient package insert, PPI, in order for patients to be fully informed of the benefits and risks involved with the use of these drugs. Oral contraceptives for birth control were first available in the 1960s, and after 5 years, there were 6.5 million women using oral contraceptives or the pill. Initially, the estrogen content was much higher than the pills that are used today. Consequently, there was a higher incidence of blood clots. The FDA required that the patient package inserts due to the lack of awareness patients had of safety risks. For oral contraceptives, the PPI must be given each time the drug is dispensed in the outpatient, which is the retail setting, with both the initial fill and with refills. In an institutional setting like a hospital or a long-term care facility, the PPI must be provided to the patient prior to the administration of the first dose and every 30 days thereafter. So if the PPI is not approved as required by law, it is considered misbranding. Other drugs can voluntarily come with an FDA-approved PPI if the manufacturer feels that there is important information the patient should know about the drug. The next topic we will discuss about written patient information has to do with medication guides, commonly called med guides. So med guides are FDA-approved patient handouts for many prescription meds that may have a serious and significant health concern. The FDA does require that medication guides be issued with drugs or biologics that require patient education about how to prevent serious side effects, the risks of side effects, or if adherence to specific instructions is essential to efficacy. The manufacturer must supply the medication guides to the dispenser by providing the physical handouts or the electronic file, so that the pharmacy can print these out for the patient with their prescription refills. There are over 300 medications that require medication guides. The full list can be found on the FDA website. Select drugs that require med guides can be found in the following tables. The med guide must be given when, we're going to do 5 bullet points here. So the medication guide must be given when, first, a drug is dispensed in the retail setting for patient self-administration without supervision from a healthcare provider. This is for the first fill and refills. The med guide must be given when the first time the drug is dispensed to a healthcare provider for administration to a patient in an outpatient or retail setting. The third component is the patient or caregiver if they ask for a med guide. The fourth component, the med guide must be given out if anything has been revised in the med guide. And the fifth component, the med guide must be given when the drug is subject to a REMS that requires the med guide. So there are various classes of medications that are commonly given with med guides. These include antidepressants, ADHD drugs, antipsychotics, antiarrhythmics, diabetes drugs, long-acting beta agonists, NSAIDs, retinoids, and medications for osteoporosis, monoclonal antibody medications, quinolone antibiotics, erythropoietin stimulating agents, fentanyl products, Chantix, testosterone, and medications for transplant patients like tacrolimus. All right, and so we're going to go ahead and take a break.